is Rachel Zimmerman. I'm going to do a presentation on acute lymphoblastic leukemia, and behind me is my poster. Acute lymphoblastic leukemia, otherwise known as ALL, is a type of cancer that affects thousands of men, women, and children each year. ALL is most common in children and has a higher survival rate in children than adults. Acute lymphoblastic leukemia accounts for 80% of all childhood leukemias and about 20% of all adult cases. The origin of acute lymphoblastic leukemia is believed to stem from various genetic lesions in blood progenitor cells that differentiate in the T cell or B cell pathway. The most important idea to study and understand concerning the pathophysiology of ALL is the occurrence of genetic lesions and their effects on cell proliferation, differentiation, and survival. Chromosomal abnormalities are the primary factor in pathophysiology of ALL. However, they must join together with other genetic lesions to prompt overt leukemia. ALL can often be asymptomatic and are usually nonspecific. General symptoms include lack of energy, fatigue, bruising, bleeding, dizziness, dyspnea, infections, bleeding from the gums, nosebleeds, bone pain, swollen lymph nodes, and pale skin. In children, joint and extremity pain is more frequent. ALL can be diagnosed in many different ways, such as CBC, bone marrow tests, bone aspiration, imaging tests such as CT scan, X-ray, and spinal tests. Acute lymphoblastic leukemia has different phases of treatments. Some of the treatments include stem cell transplant, radiation therapy, chemotherapy, and targeted drug therapy. There is no cure for ALL. ALL has several complications, which include bleeding, DIC, severe infections, relapse of ALL after remission, metastasis, and death. Nursing management for patients with ALL focuses on decreasing the patient's risk for infection. The nurse should report any changes in vital signs, especially an increase in temperature, and also assess for signs and symptoms of bleeding. In conclusion, much progress has been made in patients with ALL and their prognosis.